Hello, and welcome to your first more personal anatomy lecture, where I will be covering the topics that were not gone through in great detail in your crash course videos. So why don't we get started? First off, we're going to be talking about anatomy and how we're going to study anatomy through this course. So given that anatomy is the structural or morphological characteristics of the body, we're going to study what we see. And there are several subdivisions listed here, but what we're going to focus on in this class are these first four: surface anatomy, which is what's on the surface of your body and what's underneath, and we're going to be covering that in the lecture portion and in the clinical correlations portion. Gross anatomy, which is what does everything really look like underneath the skin. Some radiology and imaging, where we look at some common images that are produced by X-ray or CT or MRI and see if we can see the same structures that we're learning about in gross anatomy. And a little bit of anatomical pathology, although you'll get more of that when you get to your clin medical courses. There are two approaches to studying anatomy. One is the regional approach, and the other is the systemic approach. In this particular course, Gross Anatomy, we're going to be studying the regional approach, which is we divide the body into regions such as the thorax, the abdomen, and so on. And this is the order in which we're going to be doing it in the class. And study each region individually and all of the structures that are contained within. The second approach is the systemic approach, where we look at anatomy according to the organ systems of the body. And here you see all the organ systems listed and some of the organs that are within those systems. And this is the approach we're going to take in the physiology portion of this course, which I've termed A and P. So you're going to see me use A and P and physiology interchangeably because you can't really talk about physiology without talking about the anatomy. So two different approaches. Neither approach is holistic in and of itself. There are some issues. There's things you leave out. There are things that seem like they're disconnected. So we're going to take both approaches across both the anatomy and the physiology course. And hopefully you'll see how they both tie together. So in this slide, I'm only going to cover a couple things that were not necessarily covered in your crash course. So make sure you watch that. Two things that weren't covered in terms of plane of reference are your oblique and your longitudinal. Oblique would be a section that's going longitudinally and transverse, or sagittally and transverse, where you get a diagonal cross section of the body. And longitudinal would be along the long axis of the body. And we use these terms typically more when we're talking about an organ, such as the heart or stomach, intestines, or blood vessels. So not as common as the other ones, but you will see them come up when we're talking about more specific anatomy. Additional terms that were not covered in the crash course: superficial versus deep. Of course, inside the body, underneath the skin would be more deep. Superficial would be more towards the surface, so you would say the skin, for example, is superficial to the heart, or the stomach is superficial to the skin. Another set of terms is contralateral versus ipsilateral. Contra means opposite, so contralateral would be on the opposite side. Your left arm is contralateral to your right arm. And ipsilateral means same side, so your left hand is ipsilateral to your left shoulder, or your left leg is ipsilateral to your left arm. And then two other terms that you'll get more in clinical practice when you're talking about somebody who is lying in a hospital bed: supine versus prone. Supine would be laying down on the bed with your back on the bed, and prone would be just the opposite way, where you're laying face down, stomach down, face down. And I know most of you may know all of these terms or most of these terms already, but it's a good refresher to go through because we're going to be talking about them frequently in this course, and definitely when you get to all of your more clinically relevant courses, they'll be coming up again. And finally, levels of organization. I'm not going to go through this because I think your crash course video does a pretty good job talking about this. However, I will say that throughout this course, primarily we'll be focusing on tissues, organs, organ systems, and the organism and how they all link together.